Neoplasia. It is a mass of tissue formed as a result of abnormal, uncoordinated and unwanted proliferation of cell even after inhalation of stimulus for the growth which causative. Type of tumor. Benign tumor. They are usually show growing and localized tumor without causing much harm to the host. Malignant tumor. They proliferate very rapid, spread through body, may eventually cause death to the host. Difference between benign and malignant tumor. Boundary. Benign, encapsulated with proper border. Malignant, non-capsulated and irregular. Surrounded tissue. Benign, often composed. Malignant, usually invades. Size. Benign, usually small. Malignant, usually large. Second changes. Benign occur less often. Malignant occur more often. Pattern. Benign usually resemble the tissue of origin closely. Malignant often poorly resemble to the tissue of origin. Function usually well. Malignant become abnormal. Chromosomal abnormality. Benign non-frequent. Malignant invariably present. Metastasis. Benign may be present but in typical form. Malignant metastasis is increased and generally atypical and abnormal. Basal polarity. Benign retained. Malignant mostly lost. Benign pleomorphism usually not present. Malignant often present. Benign hyperchromatism. Benign absent. Malignant generally present. Tumor giant cell. Benign may or may not be present. Malignant always present. Growth rate. Benign usually slow. Malignant usually rapid. Local lesion. Benign often compressed with surrounding tissue. Malignant usually invade in further surrounding tissue. Metastasis. Benign absent. Malignant frequently present. Rate of growth. The tissue cell generally proliferate for more rapid than the normal cell. The rate at which the tumor enlarged depend. Doubling time of tumor cell. Malignant tumor cell have increased metastasis rate, doubling time and slower death rate. Degree of differentiation. Poorly differentiation tumors show aggressive growth pattern as compared to the better different tumor. Therefore, the malignant tumor are mostly poor differentiation. The rate of loss of tumor cell. Usually the malignant tumor gained size because the cell production exceeds the cell loss. Clinical and cross feature. Clinically, the benign tumor are generally slow growing and may remain asymptomatic for the long time. Subcutaneous lymphoma, while malignant tumor grow rapid and may ulcerate on the surface, invade locally into the deep tissue, may also spread the distant site. Generally spheroid or ovoid in shape. There are encapsulated, firm and uniform, while the malignant tumor are usually irregular in shape, extend into the adjacent tissue. Microscopic feature. The pattern are arranged are tumor cell. The best appreciation by the microscopic examination of tissue selection. Example: epithelial tissue general consists of columns of record of epithelial tumor cell arranged in papillary pattern. Also, anaphylaxia, lack of differentiation. It is characteristic feature of most of the malignant tumor. Malignant tumor may be poorly differentiated or undifferentiated law of polarity, commonly seen in malignant tumor. Pleomorphism, various size and shape. It is usually present in malignant tumor. In order to provide nourishment to growth, new blood vessels are formed from the pre-existing vessel. Tumor, general pulmonary inflammation, reaction are also present in all around them. These inflammation changes are mediated by lymphatic plasma cell, macrophage, cancer phenotypic stem cell, normally growing in an organ are under proper growth control. Perform this assign function along mainly the balance between the proliferation rate of cell death apoptosis. However, the cancer cells show abnormal behavior as under the growth controlling the signa in the blood and therefore proliferate rapidly. Cancer cell escape death signal and immortality. General cell lose the property of differentiation, therefore little or non-function. Due to loss of growth control, the cancer generally unstable, develop in new mutation. This cause cancer cell usually arises from the stem cell called as tumor initiating cell. Spread of tumor. One of the cardinal feature of the malignant tumor, it is ability to invade, destroy the surrounding tissue and also may spread to distant site of metastasis.